This information is brought to you by the Brain and Spine Foundation and the Neurological Alliance and is based on version 6 of the Association of British Neurologists guidelines. This is for anyone living with a neurological condition or those closest to them. Neurological problems result from injury or changes to the functioning of the brain, spine, muscles or nerves. 1 in 6 people in England live with one or more neurological conditions. If you have a neurological condition, we hope this information will help you understand more about your risk from COVID-19. It should also guide you through the steps you or your medical team might wish to take to lower your risk. This information should be used in addition to NHS and government advice, as the NHS website will always be the most up-to-date source of advice. In summary, everyone should be social distancing. This means only going out for food, health reasons or essential work, and keeping at least 2 meters away from other people when outside. If you're considered at high risk of infection, extremely clinically vulnerable, you should be shielding until at least the end of June 2020. We'll cover what this means later. Living with a neurological condition alone doesn't mean you're at a higher risk of getting COVID-19 or a severe form of the virus. Your risk is likely to be higher if you have other health conditions as well as neurological problems. Here is a summary of further advice. Coronavirus can make anyone seriously ill, but the government and NHS have recognised that some people are at higher risk or extremely vulnerable. The NHS is able to identify some people at high risk, which may include you if you're taking medicine that weakens your immune system, have difficulties with breathing or swallowing, for instance if you need artificial feeding, have had an organ transplant, or are having certain types of cancer treatment. This may also include you if you have blood or bone marrow cancer, such as leukemia, have a severe lung condition such as cystic fibrosis or severe asthma, have a condition that makes you much more likely to get infections, or are pregnant and have a serious heart condition. Most people with neurological conditions don't fall into these groups, but hospital specialists are now permitted to identify high-risk patients themselves. If you're considered extremely vulnerable, you may have already been contacted by the NHS. But many of the people who have been identified by their hospital specialist may not yet have been contacted. If you think you or a loved one are in this category and have not received a letter or been contacted by the NHS, get in touch with your GP. They may be able to help or might suggest that you contact your hospital doctor by phone or online. Some neurological conditions can affect your risk from COVID-19. The Association of British Neurologists, ABN, has looked at the evidence to consider which conditions may be low, moderate, or high risk. There are a number of reasons why a neurological condition might mean you're at a higher risk from COVID-19. In particular, if your condition or treatment are weakening your immune system, either due to your condition or treatments you're taking, or if your condition affects your swallowing or breathing. This is because COVID-19 affects your lungs and airways. A combination of these factors will increase the chance of having a severe form of COVID-19 infection. For individuals at the highest overall risk, you should follow the guidance on shielding. We'll cover what this means later. Further guidance about specific neurological conditions and COVID-19 is available from the Association of British Neurologists website, theabn.org. Some types of treatment for neurological conditions can affect your risk from COVID-19. The Association of British Neurologists has produced guidelines for patients, their carers, and medical staff to help them make informed decisions with you about your treatment. In many cases, the ABN's advice is that the risks of stopping treatment are greater than the risks of being infected with COVID-19. But your individual risk is something you may need to discuss with your GP or neurology team. You should never stop or alter treatment without talking it through with your doctors. Treatments that alter your immune system are more likely to increase your risk or vulnerability to COVID-19. Taking azathioprine, mycophenolate mofetil, and methotrexate may increase your risk, but the ABN advises you should continue taking your treatment. However, if you're taking any of these treatments along with prednisolone, 10 milligrams or more, then your risk is high. The ABN advises you to continue taking your treatment, but to follow the guidance on shielding. We'll cover what this means later. The steroid drug prednisolone may also increase your risk if you're taking 10 milligrams or more a day, along with other drugs that alter your immune system, or you take 20 milligrams a day, even without other drugs. This is because steroids increase your risk of diabetes, hypertension, and high body mass index, BMI. These have been linked to poor health outcomes after a COVID-19 infection. If you have other risk factors for COVID-19, such as heart disease, then this could put you in a high-risk category. Check with your GP. The drugs infliximab, rituximab, and ocrelizumab may increase your risk of viral infections. This means you may be more likely to become infected with COVID-19, although infliximab is also being considered as a possible treatment for COVID-19 infections. But the ABN's advice is the benefits of these treatments for your neurological condition outweigh the risk of infection. But they also suggest your medical team may change the timings of your treatment to reduce your risk without affecting your neurological condition. Different disease-modifying therapies, DMTs, for multiple sclerosis carry different risks. The ABN says these risks are generally moderate. If you're taking a DMT and think you have coronavirus, you should be able to continue taking it if your symptoms are mild. But check with your neurology team. Further details about these drugs is available on the ABN website. Some treatments normally need you to come to hospital frequently. This may not be possible or safe during the height of the COVID-19 pandemic. Your neurology team will review when your next treatment is due and will discuss alternative options with you if needed. Further information about neurological treatments and risks is again available from the Association of British Neurologists website. You should never stop a treatment or therapy without first discussing it with your neurology team. There are some particular cases where your healthcare team might want to discuss changes with you. If you have multiple sclerosis or MS, then your treatment might be complex and your neurology team may recommend changes. In some cases, your neurology team may decide to delay starting your treatment or restarting treatment until the risk from COVID-19 is lower. They would only make this decision if they feel it's safe to do so. Some treatments may need you to come into hospital. In the current conditions, this may not be safe, so your neurology team will discuss this with you. If you're at high risk of getting seriously ill from coronavirus, there are extra things you should do to avoid catching it. You should follow the government advice on shielding. This is about strictly limiting face-to-face contact with other people. It means you should stay at home and try to avoid contact even with people in your home. Avoid any gatherings or meeting with other people. Arrange for any food or medication to be delivered and make sure it's left at the door to avoid contact. Work from home if you can. If you live in England and need help getting deliveries of essential supplies like food, you can register to get coronavirus support on the gov.uk website, or you can call 0800 028 8327. You should register even if you don't need support right now. And everywhere in the UK, you can find out what your local government can do to support you from the relevant local authority website. A number of community groups have also set up around the country to offer support to people who need to stay at home. You may have had a leaflet through your letterbox offering help if you need it. Or you can look for groups near you on websites like covidmutualaid.org or nextdoor.co.uk. If you're in a high-risk category, then you should seek medical advice as soon as you start to have symptoms. Use the NHS 111 online coronavirus service or call 111 if you do not have internet access. Call 999 for a medical emergency. For anyone else, do not leave your home if you have either a high temperature, this means you feel hot to the touch on your chest or back, you do not need to measure your temperature, or a new continuous cough. This means coughing a lot for more than an hour, or 3 or more coughing episodes in 24 hours. If you usually have a cough, it may be worse than usual. To protect others, do not go to places like a GP surgery, pharmacy, or hospital. Stay at home. After 7 days, if you no longer have a high temperature, then you do not need to stay at home anymore. If you still have a high temperature, then you should continue to stay at home until it returns to normal. If you still have a cough after 7 days, you do not need to stay at home. This is because a cough can take a while to go away, even after the infection has gone. If your symptoms do not improve after 7 days, or if your condition gets worse, then use the NHS 111 online coronavirus service. If you do not have internet access, call 111. Only call 999 for a medical emergency. During this time, all NHS services will be severely stretched to help manage the number of cases of COVID-19 being treated in hospitals. You might find it more difficult to contact your neurology team for this reason. Most GP surgeries are advising patients not to turn up in person, but to contact them by phone or email wherever possible. This is to reduce the risk of coming into contact with the virus. However, if you have a scheduled hospital or other medical appointment during this period, talk to your medical team to ensure you continue to receive the care you need and consider whether appointments can be postponed. Whether you're social distancing or self-isolating, you may feel anxious or stressed during this time, and that's completely normal. There are simple steps you can take to look after your mental health and well-being. Stay in touch with family and friends over the phone or on social media. Try to keep yourself busy. You could try activities like cooking, reading, online learning, and watching films. Do light exercise at home or outside. Talk about your worries. You aren't alone. Remember, this is a difficult time for everyone, and sharing with family and friends how you're feeling and the things you're doing to cope can help them too. There are lots of people and organisations who'll provide a listening ear when you need it. Try and get a good night's sleep. Manage your media and information intake. 24-hour news and constant social media updates can make you more worried. If it's affecting you, try to limit the time you spend watching, reading, or listening to media coverage of the outbreak. Get the facts. Gather high-quality information that will help you to accurately determine your own or other people's risk of contracting coronavirus so you can take reasonable precautions. Gov.uk or the NHS website will always have the most up-to-date and reliable information. There are lots of sources of support for you. Charities across the UK are on hand to provide information and support and can help you to connect with others too. You can find links to many of these on the Brain and Spine Foundation website, www.brainandspine.org.uk. You can also contact their helpline on 0808 808 1000. They're open from 9 a.m. to 4 p.m. Monday to Thursday. For more on how charities are working together in response to the coronavirus pandemic, visit the Neurological Alliance website at www.neural.org.uk. Thank you for watching.